And immunologist, Dr. Ravi Polasani. Welcome back to the show.
Thank you. Thank you for having me.
Nice to see you. You didn't bring this lousy weather with you, did you?
I did.
This is, I guess we're finally here at the start of some winterish weather.
Right.
And it's a trigger. This change in weather is
Yes.
a trigger for asthma, isn't it?
Yes, definitely. Change in weather, the cold air especially constricts airways, and people do cough, wheezing, shortness of breath, chest tightness. Yeah, and not only the weather, but also the infections more common at this time because of the virus is active with the cold weather, and the people pass each other, and then asthma flares.
What is asthma? Is it a condition that anyone can develop?
Yes, asthma is a complex disease. It involves airways. Basically, it's inflammation that changes in the airways. So raw, red, and mucus production that causes constriction of airways, bronchospasms, and then people develop the symptoms. A lot of mucus production that so they cough and expectorate mucus.
Is a person, anyone susceptible to developing asthma?
Yes, asthma can start any age. It's more common in kids, but it can happen any age. So basically, it's a hyper sensitive airways. So people can never grow out of asthma. The sensitivity remains. The symptoms will go away, but they can come anytime.
Can it go away completely at some point? Can you age out of it?
Yes, but it can return. Kids have more chance of growing out of asthma symptoms than adults.
So we know triggers include the change in weather. Is there a cause to asthma outside of triggers? Is there something that either in someone's genetic makeup, in their diet, in their environment that causes it?
Definitely. Various things can play. Genetic definitely runs in the family, and those family members cannot grow out of asthma if there's a strong family history. Then the environment, and then acid reflux is another trigger, and infections can cause asthma. And allergy is the main trigger. Allergic asthma is caused by more allergens. Inhaling pollen, mold, dust mites, and pet dander can cause asthma flare.
So we're in the house more. We're closed in.
Yes.
So we're going to be maybe susceptible to asthma because of things like dust mites.
Yes. Yeah. Not only especially this time of the year, you're spending more time indoors, exposed to pets, more dust mites, and even mold. And then also now because of holidays, people are coming in, and some of them can have an infection like a viral they can catch, and asthma flares. I see more patients this time of the year with asthma flares.
What about the respiratory diseases like COVID, for example, or flu,
Yes.
or RSV, or pneumonia? Are those dangerous things to have happen to someone who's an asthmatic?
Yes. Oh yeah. That's also the big trigger for asthma flare. They end up going to the emergency rooms and urgent care, get hospitalized, needs albuterol treatments, to help to breathe better.
Do you recommend the vaccinations for those?
Yes, definitely. Especially vulnerable patients, like people have multiple conditions, other medical conditions. They can have more flare and then end up in the hospital. Definitely those people need vaccines.
How young can someone be to be afflicted with asthma?
Well, you can
Infants?
have even infants too. As soon as they're born, they can have asthma too, So, but especially some kids, when they get RSV infection, they do get symptoms then, and then what happens once they're treated, every time they get a cold, their asthma flares. It's called infection-induced asthma. And then they grow out of the asthma between age 4 to 6 years of age.
How is it treated? Is it
So-
inhalers?
Yeah, see, asthma, there's an intermittent asthma, there's a persistent asthma. Intermittent asthma is symptoms less than 2 times a week. So that can be controlled with as needed bronchodilators. Those are short acting, they open up airways so they can breathe better. So those people don't need any controllers. But people with persistent asthma, if they have symptoms more than 2 times a week, or they're waking up more than 2 times a month during the night with the asthma symptom flare, so those people need controller on top of their rescue inhaler.
So they're feeling like they can't breathe? Is that the
Yes.
feeling?
Yeah, they can breathe and chest tightness, wheezing, cough. Those are the asthma symptoms.
Are there different medicines in these inhalers that are prescribed based on the type of asthma that someone has?
Yes. Yeah, the albuterol is a rescue, that opens up airways. That's all it does, but it doesn't do anything to inflammation of the airways. Whereas the controllers, those are inhaled steroids. The steroid reduce the inflammation, decrease the mucus production. So it basically controls symptoms so that they don't need to use so much albuterol, and then they can do their activities easily.
And if someone has it so bad that they're hospitalized, what's the treatment in a hospital?
The hospital, usually they give do breathing treatments. The combination product, albuterol and ipratropium, opens up airways, and then once they're doing better, the oxygen goes up more than 90%, they can send those patients home on short course of steroids, oral steroids, like to reduce inflammation, to prevent further attacks.
Can you die from asthma?
Oh yeah,
Really?
people do die from asthma, yes, definitely. Especially severe asthmatics, if they have previous history going to the emergency room or hospitalized, and those patients can die with asthma.
Every once in a while, you'll see an athlete, even in the Olympics, there were asthmatics competing in the Olympics, that at the end of their run, they would use an inhaler. Does the exercise
Right.
cause someone to come to get an attack?
Sure, yeah, there's such thing as exercise-induced asthma. They have shortness of breath, wheezing only during exertion. And those people would recommend taking the rescue inhaler before instead of treating later when they have an attack. So when they take before, like 15 minutes before, it opens up the airways, they can do better.
Is there anything you can do to avoid asthma? If you, like me, I've never had asthma. Are there any things that I can do to make sure I never get it?
So you need to know your triggers, what makes asthma worse. So then you avoid triggers. Triggers are, some people have exposed to secondhand cigarette smoke, chemicals and perfumes, colognes, and avoiding people of infection so that you don't catch it and your asthma flares. And the acid reflux can make asthma worse, so make sure your acid reflux is controlled well. The major triggers are acid reflux, infections, allergens, and exertion for asthma.
Yeah, and so acid reflux, that's something that does develop as someone ages too.
Yes,
So you could
it can happen
suddenly
anytime.
become,
Even kids have asthma, acid reflux. It's very difficult to diagnose. And those people cough a lot too.
well, if
And there's
anybody,
such-
and if somebody wants more information and they want to get tested for allergies or for asthma treatment, you're the guy.
Yes, yeah, we do testing and see what they're allergic to, and then those are the triggers. Not only that, we do breathing test to find out where the problem is in the lungs, the large airways, small airways. So we explain, how to avoid triggers and how to treat, and the important thing is patients, when they feel they stop medications, that's not the way to do it. So taking controllers regularly, their quality of life is much better.
And you can take the misery out of their lives.
Right, exactly.
Well, thanks for coming in today.
Thank you very much for having me.
Yeah, good to see you. Happy Thanksgiving.
Thank you. You too.
Dr. Ravi Polasani from Asthma Allergy Centers. Up next,